It's time for an apple fritter. Here's your host, Jimmy Apple.
Welcome to another episode of An Apple a Day's The Fritter. I'm your host, Jimmy Apple. How you feeling today, my friends? You feeling good? You feeling strong? You feeling better than you did yesterday? Excellent. You can't ask for better than that. Today's subject is, what is a panic attack? Sit back, relax, and listen to what Dave has to tell us about this subject.
What is a panic attack? A panic attack causes sudden, brief feelings of fear and strong physical reactions in response to ordinary, non-threatening situations. When you're having one, you may sweat a lot, have difficulty breathing and feel like your heart is racing. It may feel as if you're having a heart attack. Panic disorder can develop when you worry too much about having another one or change behaviors to avoid having a panic attack. Every year, up to 11% of Americans experience a panic attack. Approximately 2% to 3% of them go on to develop panic disorder. Anyone can experience one. These factors play a role. Age. Panic attacks typically first occur during the teen or early adult years. But people of all ages, including children, can have them. Gender. Women are twice as likely as men to develop panic disorder. Experts don't know why some people experience panic attacks or develop panic disorder. The brain and nervous system play key roles in how you perceive and handle fear and anxiety. Your risk of having them increases if you have family history. Anxiety disorders, including panic disorders, often run in families. Experts aren't sure why. Mental health issues. People who have anxiety disorders, depression or other mental illness are more prone to panic attacks. Substance abuse problems. Alcoholism and drug addiction can increase the risk of panic attacks. They occur suddenly and without warning. There's no way to stop a panic attack after it starts. Symptoms usually peak within 10 minutes after it starts. They disappear soon after. Signs of a panic attack include chest pain, chills, choking or smothering sensation, difficulty breathing, fear of losing control, feeling like you're going to die, intense feeling of terror, nausea, racing heart, sweating, tingling or numbness in fingers or toes, trembling or shaking. Here's the catch though. Serious health problems, such as heart disease, thyroid disease and respiratory problems, cause symptoms similar to panic attacks. Your healthcare provider may run tests to rule out a physical problem. If there's no physical cause, your provider may make a diagnosis based on your symptoms and risk factors. Medical or mental health providers can diagnose panic disorder. Your provider may diagnose it when you have repeated panic attacks and you persistently worry about having more of them or their consequences. Obsess about losing control during a panic attack. Change your behaviors to avoid situations that may trigger one. Psychotherapy, medications or a combination are very effective at stopping panic attacks. How long you'll need treatment depends on the severity of your problem and how well you respond to treatment. Options include psychotherapy. Cognitive behavioral therapy, CBT, is a type of psychotherapy or talk therapy. You discuss your thoughts and emotions with a mental health professional, such as a licensed counselor or psychologist. This specialist helps identify panic attack triggers so you can change your thinking, behaviors and reactions. As you start to respond differently to triggers, the attacks decrease and ultimately stop. Antidepressants. Certain antidepressant medications can make panic attacks less frequent or less severe. Providers may prescribe serotonin selective reuptake inhibitors, SSRIs, serotonin norepinephrine reuptake inhibitors, SNRIs, or tricyclic antidepressants, TCAs. SSRIs include fluoxetine, Prozac, and paroxetine, Paxil. SNRIs include duloxetine, Cymbalta, and venlafaxine, Effexor. TCAs include amitriptyline, Elavil, and doxepin, Sinequan. Anti-anxiety medications. Benzodiazepines are the most commonly prescribed anti-anxiety medication to treat and prevent panic attacks. They help with anxiety but have risks of addiction or dependence. These medications include alprazolam, Xanax, and lorazepam, Ativan. Panic attacks are highly treatable. Unfortunately, many people put off seeking help because they're embarrassed. Untreated panic attacks or panic disorder can interfere with your ability to enjoy life. You may develop anticipatory anxiety. The possibility of having a panic attack triggers extreme anxiety. Phobias. A phobia is an extreme, unreasonable fear of something specific. For instance, acrophobia is a fear of heights, while claustrophobia is a fear of enclosed spaces. Agoraphobia. Approximately 2/3 of people with panic disorder develop agoraphobia. This anxiety disorder makes you afraid to be in places or situations where a panic attack might happen. The fear can become so extreme that you become too afraid to leave your house. Your healthcare provider can help you identify triggers that bring on panic attacks. During psychotherapy, you learn strategies to manage triggering events and prevent an attack. You can also take these actions to lower your odds of having one. Cut back on caffeine. Exercise regularly. Eat a healthy diet. Manage stress. Talk to your doctor before taking herbal supplements or over-the-counter medications. Certain substances can increase anxiety. With treatment for panic attacks, most people get better. Taking the positive step to seek treatment is key to stopping the attacks so that you can enjoy, and not fear, life. Some panic attacks have signs that can be confused with a physical problem like a heart attack. If you have chest pain or trouble breathing or lose consciousness, seek emergency medical care. You should call your healthcare provider if you have panic attacks and experience chronic anxiety that interferes with daily life. Difficulty concentrating, extreme irritability, fear of leaving your home, agoraphobia, panic attack symptoms that last longer than 15 minutes, sleep problems. If you have panic attacks, you may want to ask your healthcare provider, why am I having panic attacks? What is the best treatment for panic attacks? How long will I need therapy? How long do I need to take medications? Should I look out for medication side effects? Panic attacks can be extremely uncomfortable. Although they're not physically harmful, they can take a toll on your mental health and stop you from doing the things you love. Don't be embarrassed to tell your healthcare provider that you have panic attacks. Your provider can help you overcome fears and anxieties that trigger attacks. You can get better with treatments like psychotherapy and medications. I hope you found this interesting and helpful. Have a wonderful day, friends. And now, I'm going to pass this back over to Jimmy.
Thanks, Dave. I want to share some news with you guys, the listeners. As of January 5th, we got notice that an apple a day and an apple a day fritter is being heard in 104 countries worldwide. That's right, we're being heard in 104 countries. And that's thanks to you, the listeners. So, thank you. Thank you for being here today. Thank you for being here right along. That's stupendous. I'm so grateful. But I want to remind you, an apple fritter comes out 5 days a week at 4 a.m. every day. So we're here for you. And again, I want to thank you. And I want to remind you, no one ever went blind by looking at things from the bright side. So make sure you give it a shot. Look at things from the bright side. And do me a favor. Please be the reason today that somebody smiles. It'll make you feel good. It'll make someone else feel good too. Hey, you've been listening to an Apple a Day's The Fritter. I'm your host, Jimmy Apple. And I'll talk to you again real soon. Have a great day today, my friends.
Join Jimmy tomorrow for another apple fritter. In the meantime, stop over at our YouTube group page, Living with a Disability, join in the conversation and make some new friends. See you next time.